Alrighty, it's about 3 after. A few others might join, but let's go ahead and get started. Thank you for joining. You are here for the eMed Apps framework content, everything you need to know about configuring NextGen. Everybody is in listen-only mode. If you have questions during the webinar, feel free to shoot those over in the questions box at the bottom of your menu. We will try to get to those as we're moving along. If we don't have time, we'll try to reach those at the end. There's a picture of the box. So go ahead and put those in there and we'll get those answered. You will be a mute, but I will make sure to interrupt and get as much as I can answered on time. Alrighty, a couple other little housekeeping things. Oh, we got something ringing that shouldn't be. If you guys want to follow us on any of our social media platforms, we are on Facebook, LinkedIn, Twitter, and we also have a YouTube page. So feel free to follow us in those places. We are being recorded today. You will receive a copy of the recording as well as the slides. Usually that comes out about a day or two after the webinar has been finished. Look for an email from the webinar just like you got your invite. We also should follow up as well. And a few things about eMed Apps. I'm not sure if she has that slide back up again. Sorry about that. That phone call threw us off a bit. eMed Apps is a healthcare information technology services company. We provide practice clinics and hospitals with a full range of services as well as a suite of products that are designed to increase efficiency and facilitate communication. We've been in business since 1999, worked with NextGen since 2001, and we work as a subcontractor for NextGen. We serve healthcare clients all across the USA, and we have services and products that are for NextGen clients only, as well as other products that work with other EHRs. Okay, and about our presenter today, Yvette Bujak. She has been with us for 14 years of experience with NextGen products. She's NextGen certified in EPM, EMR, Patient Portal, and ICS. She has over 17 years of experience in the healthcare industry, and she's typically responsible for implementations, project management, template development, workflow design, training, and support of the NextGen EHR product. Very well versed and a great presenter. So I will hand it over to Yvette.
Thank you, Holly.
You're welcome.
Welcome, everybody. Thanks for joining the webinar today.
We lost your sound.
I was talking to myself. Apologies. We're bumpy road this afternoon. Sorry about that, guys. All right. So today we're going to be covering NextGen's framework content. We're going to go ahead and kind of go over why it is important. Why should we take a look at it? What is it, and why is it important to you guys as a practice? We're going to go through how do we access those templates, and then we're going to go ahead and go into each one of those steps. As to what can be configured, tabs and SubNavigation, the reasons for visit, the procedures that are for my specialty, default visit specialties for providers for your multi-specialty practices. And then we're going to also go over some of those new items that are available for the new intake, the new SOAP, and then in 2021, the new pediatric SOAP as well. So we can't customize those, but NextGen has given some great availability to go ahead and configure those templates. So I'll show you guys those cool new features that they've added onto there, and hopefully cut back on some of the customizations that you guys have in the practice on those templates, so you guys become more upgradable in the future, to be able to take on more of those new upgrades. So what is framework content and why is it important? So framework content within NextGen kind of controls if I have a screenshot down below here, the intake template, the histories, the SOAP, the finalize, the checkout. If I want to go ahead and maybe remove the histories, I can go ahead and do that with this configuration template. Or if for a specific workflow for my nurse visit, maybe workflow, I want to go ahead and add an additional template because it's important to my specialty and to my practice that the nurse remembers, maybe it's the prepare template or something like that. We can go ahead and configure and add those items into here. Same thing with the little links here below. the sub-navigations. We can modify those by specialty. We can even go down to the practice, and then we can also go down to provider level. And I'll get a little bit more into that in the next couple slides. So why is it important? We kind of want to take a look at the workflow that the providers and users are doing within the practice and take a look at it and make sure that, are they going through the system? Are they, doing several clicks to go hunt down a template that they're using daily? Is it something that we can go ahead and add into these links so they can navigate there quickly? Same thing with the top 14. We can go ahead and configure those and make sure that we have the most relevant information in those HPIs for our providers, so they're not constantly typing or searching for templates within the system. Another nice feature about this is these configuration changes in the database, they remain. So if you guys do take an upgrade in the future, those settings will go ahead and continue and carry forward. So it's a configuration, it's not a customization that'll need to be done later on in the future. So how do I access the templates? So first you'll need to go ahead and log into the EHR. From the EHR, we're going to go ahead and select File, System, Practice Template, and then we're going to go ahead and select All down here. If you guys already have some favorites set up, and a lot of you guys it might be available there already for you in your preferred templates. If it's not, you can go ahead and select All, and then click Configuration Home, and then click OK, and then you'll be able to see the framework content template over here on the side. And that'll go ahead and launch the template that we're going to go through today. Some of you guys on the call, if you guys go to File, System, Practice Template, you guys don't see any templates available. It may be because you guys don't have access to those templates. So I would go ahead and reach out to somebody within your IT department to talk to them about the configuration and customization or configurations that you would like to do. So this is a screenshot of what the template looks like. I went ahead and collapsed all the panels on there so we could just take a look at the whole template and everything that it has available. So like I said earlier, we can go ahead and configure those tabs and sub-navigations up top. We can configure reason for visit, what physical exam shows up for my specialty, review of systems, medical family history, procedures, medical chart tab on the home page. So those options that show up on the home page where you can view all the history on the patient. Default visit by specialty, assigning specific providers a specialty so they don't have to select it when they launch certain templates. And then client button configuration, assessment plan configuration, and client checkbox configuration. And I'll get into those. Those are on the newer templates as we go forward. So framework content template. If we go ahead and open up the template, at the top we have specialty, we have practice, and provider. So I kind of gave you guys a visual down here. So if I'm on my configuration template, on my framework content template, if I have family practice selected, I'm going to go ahead and configure that family practice specialty in the system. And for those of you guys, picture might look a little bit different on some of these. I did use screenshots of the newer templates in the presentation for today. So they might look a little bit different than what you guys are used to today. So we can go ahead and configure by specialty. We also do have an option for practices that have multi-specialties. Multi-practice. Each practice's family practice can have a slightly different setting if you choose to. And then we can also get down and configure it down to the provider level. Now, at the provider level, I always say to use this with caution. Because if you kind of get down in the granular detail, it gets a little bit more difficult to maintain or even troubleshoot. Why do the templates look different for this provider? And somebody could be confused about that. Even your users, they're missing templates or something like that. But there's a couple examples that it's a good use for. For example, like endocrinology, a lot of those surgical specialties. So if we have general surgery and we have a lot of subspecialties under that general surgery, you might want to have different HPIs for those subspecialties. So in that case, we would go ahead and select those providers for those subspecialties under the specialty of general surgery, and then build out their information for their templates. Even down to the procedures. The procedures will probably look a little bit different. Nice thing in here, you guys do have the ability to go ahead and copy the information. So I can copy the configuration that I've done from one specialty to another. So for instance, if we want to copy information from family practice to internal med, and then, maybe change their top 14, but I've got my framework for my visit types all set up correctly, but I want to go ahead and copy the information over. You do have that ability. The example that I just used for the surgical subspecialties, for each subspecialty, you can go ahead and set up one provider and then come down here and copy that information from that one provider that you've already configured to those other ones. You don't have to keep repetitively doing it and reselecting it each time. So, kind of cut some steps out over there. It makes it easier to manage within there. Okay. So over here, I kind of expanded out the framework content. So in this example over here, I do have my specialty of family practice selected. And you guys could see that on my intake template over here, that I do have family practice. The office visit that I have selected, the visit type that I have selected here is office visit, and that reflects here. And then you could see that my tabs line up. So here's my intake, here's my histories, here's my SOAP, here's my finalized checkout, and then so on. So if I wanted to go ahead and, let's say add the prepare template to the workflow, I would go ahead and give it a caption. I'll click the list, I'll search for a template. It's the incorrect template there, by the way, so don't go by my screenshot. And then I would just go ahead and click update. So the next time I go into the EHR and I select family practice office visit, my new template at the end here is going to be available to me. Same thing with these tabs below. So your SubNavigation. So over here, we've got standing orders, adult immunizations. They all match up. So if I need to add or remove any of them, I would go ahead and select on my tab 1 for my intake. I would go ahead and add or remove anything. And then I would go ahead and click the update button. So it's really configurable, cuts time on, trying to get to those specific templates that your users are looking for. And again, if we want to add additional items to the workflow, that can be done. Another example I've seen others do is, the intake and the SOAP, they've got a lot of that history information on them now. We might want to opt out to go ahead and remove that histories template if you choose. For a nurse visit, maybe the nurses shouldn't be billing for a specific visit based on your specialty. We can go ahead and remove that finalize. Again, just depends on your workflow and what your practice needs. Okay, so the home section, there's a button, and I'll show you guys on the next screen. We can also modify the home page. So if you guys have made any customizations to your home page, and you want to launch a different home page when that little house is selected, that can be configured. We can add and remove specific visit types. A couple things to note on here. Each visit type is configured to a range of CPT codes, which are used to calculate the E&M code on the finalized visit. So if you guys select specific, pediatric well child visit, when we go to finalize, we calculate a code, we're going to get that, well child visit code calculated for us, versus when we go ahead and select office visit, we're going to get our 99213 and so on when we select calculate. So kind of keep that in mind when you guys are adding and removing those visit types. Another thing to note for my cardiology and ophthalmology clinics, these specialties calculate a little bit differently. So you cannot add visit types for these specialties through this process. So cardiology and ophthalmology, remember those lists will be blank for you guys. All other specialties, we can go ahead and add additional ones. This is a screenshot, as you guys could see over here. I'm going directly to my SDS homepage, which is the out-of-box homepage for family practice, internal medicine, most of the specialties within our practice. And then we've got our visit types here. So if I were to go ahead and click on this list, I can go ahead and add additional visit types that are in the system and then build them out as I would need to. You also do have the ability, let's say we want to go ahead and remove tobacco cessation for some reason from my visit types to kind of shorten up that list, to clean it up, to make sure that the users are selecting the correct visit types that are pertinent to your practice and your specialty. We can go ahead and come in here and delete those. If you do delete them, they can always be re-added at a later date. So don't be afraid. There might be a little bit of work that you might have to do, because you'll have to build out, each tab and then each sub-navigation on each template. But it'll be worth it to your users to go ahead and kind of minimize those lists. Okay. So over here on the example that I have my nurse visits selected. Over here, instead of the SOAP template, I'm adding the prepare template. So I went ahead and selected my pick list. And then I searched for my prepare template, which is prepare_questionnaire. So when I select family practice, nurse visit, I will now see intake, histories, and then prepare. Once I've done that, then we'd go ahead and click update. Okay. If I want to go ahead and remove, so in this case, I'm removing the checkout template on the nurse visit. Would go ahead and select here, and I'll backspace on that caption. And then as I backspace out of that caption, it's going to automatically clear out this template that's available in here. And then I'll just go ahead and click on my update button. And again, next time I open it, it'll have the checkout template missing within there. Okay, this is a screenshot just to show you guys how to delete specific visit types. So again, if you guys are not using a visit type, it's not pertinent to your practice, go ahead and come in here, select the visit type. In this case, we've got post-operative visit, and go ahead and select delete. And it's going to give me a little bit of a warning saying, are you sure you are about to delete all the tabs for this visit type? And go ahead and click yes, and that'll go ahead and remove that from that list. And then when the user selects family practice, they select their visit type, post-operative visit will no longer be an option in there. Okay. To update the sub-navigation, so if I have my office visits selected here, the section below will show me all the sub-navigations on that visit type. So over here, I could see my intake, my histories, my SOAP. These are those blue little links below there. I can come in here, I can select my intake template because I want to go ahead and update. I can go ahead and, let's say, procedures my nurses aren't doing, but I do want to go ahead and replace that with my screening tools template, for instance. I can go ahead and backspace on procedures, type in the word screening tools, click my pick list, and then search out for that template that launches my screening tools. And then after that's been completed, I can go ahead and select update. Okay. Again, here too, if you don't want any sub-navigations on, let's say on my intake template, you can go ahead and delete it, and that'll go ahead and remove all the entries, and there won't be any sub-navigation on that template. So it is highly configurable to the way that you guys use NextGen and for the templates that you guys need within your practice. Okay. So next, we're going to go ahead and we're going to move on to the reason for visit. So here's my screenshot again. Keep in mind, this is the new SOAP template, so it'll look a little bit different to you guys than some of you guys might be used to. So if we select, our reason for visit within here, it'll display the top 14 that I have configured on my framework content template. So each specialty is allowed to have up to 14 chief complaints in the reason for visit section. So keep that in mind. You can always have 14 in there. One helpful way to go ahead and identify those top reasons for visits for your specialty is to go ahead and run a report from the EPM. In this example, I have a service item summary with extended amount and transactions ran. And what I did is I pulled in the diagnosis description, and then sorted it by the count. So I get my most count at the top of my list. And I can see that, that we're in a test database for my top diagnosis for, my practice. It's activity with handheld interactive electronic device. And if I looked at my top 14 reasons for visit, that's not one of my top 14. So, do we want to go ahead and take a look at that and make sure that that's available? If you guys are part of a multi-specialty practice, you guys might need to run multiple reports, including those providers from those specialties, so you can go ahead and identify those. So it's a nice way of looking at it. Next is a couple definitions that we'll go into for our configuration. So there's all, and this would include all the reasons for visit for the current specialty selected. So I know if you go into the HPI and you click additional, you can go ahead and select all, that'll be that all list within there. So we can configure and add to what's available within that all list. The top is the top 14 that are available for our reason for visit. And then there's filters available too. So we can go ahead and filter it down by gender. So if I have specific reasons for visit that I want to just display for a male versus a female, oops, I got a spelling error there, I can go ahead and configure those. So when I launch the intake or the SOAP template, I will see those gender specific templates for my patients. Okay. To add a top reason for visit, it needs to exist in the all list. So over here on my filter, I can look through the list of the all list that's configured for my family practice. If something is not available within there, I can go ahead and select the little listing over here to launch my pick list, and then I'll be able to search for that template. I'll select this one, I'll go ahead and click OK, and then I will go ahead and click Add. So once it's part of this all list, I can go ahead and add it to my top list. Okay. So over here, I'm sorry, I've selected my abnormal PAP, and let's say I just want this to display for my female patients. I can go ahead and select that, or I can select all if it's appropriate for the reason for visit that I have selected. Okay. Now that I've added it to my all list, I can go ahead and add that information to my top. So over here, you could see that I only have 12. I can go ahead and select over here my top, select my little button here to launch my DB pick list, search for that reason for visit that I just added to the all list. And just one thing to remember, NextGen's always been funny with this. Whenever you add something to the all list and you've just added it, it won't be in alphabetical order. You can just go ahead and scroll all the way to the bottom, and then it'll be available at the bottom of the list for you to select to add to your top 14. Okay. If something is not available in that all list, we're going to go ahead and have to switch over to a new template, which is, we guys could stay in that same thing. So you can see over here where we're hanging out in the framework content template. We can click down here and we're going to jump over to the manage template links. The manage template links is where we would go ahead and add a chief complaint and then what template we want to pop up for that. This is where you would also go and update whatever, for abdominal pain. Let's say I want the generic HPI to launch. I can go ahead and select my generic abdominal pain and then search for my generic HPI template and then go ahead and update that. So the next time the provider goes in, they select abdominal pain, it's going to go ahead and launch that generic HPI. Okay. Same thing if, there's a reason for visit that's, part of our list, like in our example was the handheld device that was top 14. Don't think NextGen really might have one like for that. So we can go ahead and type in the chief complaint for that, select our template to launch, generic, or if we look through the other templates, something else might match to it. We can go ahead and add that to the manage template links, jump back to our framework content, add it to our all list, and then add it to our top 14. Okay. You guys can also remove some of the reasons for visit. So let's say we went through, we ran that report, and our providers are not seeing many patients for back pain. So we want to go ahead and remove that from our top 14 and replace it with something else, or diabetes. In this example, I would go ahead and make my selection and then select delete, and that'll go ahead and remove it from my top 14. I can also change the order for my reason for visit. So if I choose not to sort these alphabetically, I can go ahead and select change order, select my fatigue, and then I can go ahead and select on 12 for well-child HPI. And now my fatigue will go ahead and be in the 12th spot. So that'll go ahead and be at the bottom of my list. And you can do the same thing with any of these. You just click around, it'll go ahead and drop and reorder itself to that area. You can also sort alphabetically. For reason for visit, I think it's easier to look at. It's my personal preference, and the way it comes out of the box is it's sorted alphabetically. So just by checking this box, you can automatically sort it alphabetically within the system, and you don't have to do that thinking, so it'll auto sort for you. For reason for visits, there's also submenus that we can add. The submenus are used for different items. You know, if you guys are part of a orthopedic practice and you guys are selecting an HPI for wrist, the provider might want to specify is that the left wrist or the right wrist, sorry, left wrist or right wrist, without having or taking up 2 slots in our top 14 for wrist. So we can do those submenus. Another option too is initial and follow-up. So I could say, you know, initial visit for back pain or follow-up visit for back pain are 2 examples without taking up 2 slots and using up our top 14. So here's an example. We do have to be in the all section to go ahead and configure those submenus. And these submenus can be configured before or after. In this example, we've got back pain selected, and we've got added follow-up initial. You can add up to 5, and you can have 2 submenus if you choose. So you can get down into some detail with these reason for visit if you so choose to. You know, you can do right, left, bilateral, and so on. So there's a lot of options here. You can definitely get creative with it. Over here in the example of the one that we just configured was the back pain. So if I go ahead and select my back pain, I get 2 additional options. So I can go ahead and select follow-up initial, and then I still have 14, but it'll let me expand out here, and then it'll go ahead and show up in my section over here, it'll show up follow-up back pain. That kind of makes it easier and a little bit nicer and clearer for some of those, for some of the doctors. Another section that we have is within the physical exam, and just like the reason for visits, we can go ahead and configure only 14. If you go ahead and click on the all list, you'll be able to see all the other ones that are available. But again, for your favorites, it is just the top 14, just like we have in the reason for visit. In the framework contents, again, top 14, you would use the practice most frequently used within the left pane of that physical exam. Okay. Again, same thing as we had with the reason for visit. If you want to go ahead and add a physical exam to the top, it needs to go ahead and exist in the all. If it's not in the all, we would go ahead and have to add that in the manage template links template, just like we did for the reason for visit. These can also be filtered by gender as well, if your practice chooses to. Okay. To add, just like I just said, if you wanted to add additional information, first it needs to exist in the top. In my example here, I'm sorry, in the all list. In this example, I'm going to go ahead and add carpal tunnel to my all. And then I can go ahead and specify a gender. In this case, I would go ahead and select all. And then I can go ahead and click add. Okay. You can also change the order of these. One thing to note, NextGen out of the box with physical exam, it's organized in a head to toe system. So, you know, reason for visit, we might choose to have those alphabetically, but for physical exam, those are typically organized in a head to toe. So you'd probably use more of this change order checkbox to change the order and place it in the correct area in that head to toe format system. Okay. So once we've got it in our all, we can go ahead and select our top, go ahead and search for that template that we've added, and then we'll go ahead and select add. Same thing, if I wanted to go ahead and remove one, just like we did with the physical exam, I'll go ahead and make my selection, and then I'll go ahead and click delete to go ahead and delete that information from there. And here's my screenshot for that. So in this case, we're deleting ears, and select delete. Next time I launch the intake and soap for my family practice that I've been using for this presentation, it will not show ears in that favorites for the physical exam on the soap template. Okay. This is not part of the framework content, but I threw this in there. We'll jump to our practice configuration in our framework content. If we jump down here to manage template links and then practice configuration, you can enable a gender neutral physical exam. So you click on practice, scroll down to SOGI transgender. You can enable a gender neutral physical exam and enable a gender neutral review of systems. And this is available. Some of you guys have not upgraded yet. You should have checked this before this, but I believe that this was available in 2020. So those of you guys that might be searching for this feature, it might not be available to you yet. But once you guys go ahead and upgrade to the latest and greatest, you should have these features available. A couple different things I'll just go ahead and point out really quickly that are available in here is on the master document and the patient plan, you can specify what displays within there. So birth, sex, current gender, gender identity, preferred name, preferred pronoun, and sexual orientation can be configured. So you can choose both.
I have a question.
Yep, go ahead.
Sorry to stop you. Does this apply to the behavioral health template set using the BH 3.5? And will this modify the template for the BH template?
So I haven't dug into BH 3.5, but and I do believe that 3.5 is using the regular SOAP template for some of those visit types, for like medication management and so on. If the regular SOAP template is being used, then yes, this would work for that. For the physical exam piece. But I'm trying to remember my versions. With 3.5, there is a different type of configuration where I forget what they call it, but there's a different homepage for behavioral health once you guys get over to that Topaz content, and that's configured a little bit differently. So some of this will be applicable to behavioral health if you're using the SOAP template for those HPIs, those physical exams, those review of systems. But the framework content for the tabs and navigations, that would not be applicable. Okay, good question. Okay, so we'll go ahead and jump into review of systems. So this will go ahead and allow us, just like the other ones, configure the review of systems, the favorites, and then the all list that's available to the providers on the intake and the SOAP template. Just like the other two, we're allowed to have up to 14 top ROS. Okay. Oh, sorry, there is no all in this section. So it's a little bit different than the other one. So there's no all in here. We just have our top. And again, we can have top 14 on here. So if you go ahead and come in here, select to launch our pick list. In this case, we can go ahead and add immunologic, and then we can go ahead and select it and then add it to our list. Again, we can go ahead and change the order. We can go ahead and sort alphabetically if we choose to. Again, review of systems is usually more of a head to toe format, just like it is with the physical exam. So you're probably more likely to go ahead and use change order when changing the order of our items in our pick list. Okay. You can also remove items if they are not used by making the selection and then go ahead and click delete. Okay. If you guys want to go ahead and select the gender neutral review of systems, you guys would go ahead and when you guys open up this panel for view of systems, we'd click on all genders. In the caption, we'd go ahead and write one page ROS, and then we would go ahead and search for the template PC_ROS_neutral, and that'll go ahead and give us our gender neutral review of systems. If we want a, oh, and here's a screenshot of the gender neutral review of systems for you guys to review. For those of you guys that have not seen it yet, if you guys want to go ahead and set a gender specific review of systems, that's also available. You would just go ahead and toggle from all genders to gender specific, give them a name, one page ROS, and then select the female template, male template, and then for the undifferentiated and unknown, we would go ahead and select those neutral templates. Once we're done, of course, we'll go ahead and click Save to make sure that our information is saved on the template. Okay. Medical family history. This is probably the smallest section on this template. You can configure your medical history and family history, which templates display when we're adding those histories for our specialties. So if you guys have customized something, you can come in here and configure it so that template is launched. Just keep in mind, NextGen has, released, we're not going to go over it today in today's webinar, we wouldn't have enough time, but NextGen's released a configuration template for your past medical, surgical, and family history by specialty. So a lot of those customizations can be cut back there too by just configuring the template for your specialties if you guys choose to. Okay. Next one is procedures. So on the old SOAP template, at the bottom of the template, we have that bar that, and there's a button on there that says procedures. On the newer SOAP template, we've got our little kick out over here. We can go ahead and select that, and we go ahead and select procedures, and it'll go ahead and give us a list of those procedures that are configured as favorites for this practice. Now, some of you guys may be just going directly to the procedures template that has a longer list that is still available, but this would be just configuring that button either at the bottom of the SOAP or on the side over here on the newer SOAP template. Okay, so if I go ahead and expand my panel for my procedures, I'll be able to see a list of the procedures and what template it is launching. If I wanted to go ahead and in this example add anemia injection, I can go ahead and select here, launch my pick list, select proc anemia injection, give my procedure template a name, and then go ahead and click add. So next time I go to the bottom of the SOAP or that side pop out, I'll be able to see that anemia injection is now part of my procedures list. One thing to note, there is a 40 character limit over here. So if you guys try to get a little lengthy with those, it will cut you off. And just like the other ones, we have the option to either change order manually, or you can just go ahead and click sort alphabetically, so it'll go ahead and sort automatically for you. Okay. Medical chart summary. So this is available from the home page and the summary template. In this case, I have screening tools, so it'll show me all the screening tools that have been completed on all the encounters on this patient. If I click HPI, it's going to show me all of the HPIs on this patient. So it's a good preview prior to seeing the patient versus flipping through all the documents in here. Doctor can go ahead and come to the home page, view the medical chart summary, click on the information that they need to kind of do a chart prep before they see the patients. If there's some things that are missing within here, we can go ahead and again add or remove items that might be pertinent to you guys. So we'd go ahead and scroll down to that medical chart section. And to add information, we'd go ahead and select here to click on our list. And here's some of the ones that are available. So let's say, I'm sure allergies is on the allergy specialty, but if I'm going to go ahead and select allergies, I can go ahead, click it, and then go ahead and click add, and then I can go ahead and change my order. So if it's something that, my doctors are really interested, they want to make sure that they're seeing all the allergies, I can go ahead and put that at the top of the list, whichever order you guys prefer within your practice. With this, it's kind of going in that SOAP format, so it's going down the systems. Okay. Next section is our default specialty configuration. So in this case, I have, my encounter provider, my doc in the box selected as Dr. Watson. I can go ahead and configure Dr. Watson. If I open specific templates, that my specialty should always be family practice. For those of you guys that are on the call that might be part of a single specialty practice, you would not need to go through that configuration. You guys are probably already configured this way under practice configuration. There's a setting that determines the default specialty to use. In this case, we have family practice. So any template I open in the system will always have a specialty of family practice. What we're going to go through would be for those on the call that are a part of a multi-specialty practice. Okay, the configuration I'm going to show you guys is available on all these templates. So all your home pages, all your SOAP templates, all of your intake templates, your telephone call, provider test action. So eliminates a click and prevents user error too. So if you have nurses or MAs, switching between specialties, less likely chance of them making an incorrect selection, and it saves them a couple clicks as well. Okay. One thing to note when you get a new provider in the practice, they are built as a rendering provider in file maintenance, and you may or may not be selecting a specialty code for that provider. If a specialty code is selected here, when you guys open the framework content template, you guys will notice that family practice could be assigned there already. Now, if I go to my EHR template and make the changes within there, this will not change the specialty code in file maintenance. So if, when my provider is first set up, family practice is selected, I'll go ahead and launch my specialty configuration. I'll see that family practice is already assigned, but I need to go ahead and maybe change it to internal medicine for some reason, because my family practice providers are all using internal med templates for my practice. I can change it on the template and it will not affect my selection in file maintenance. So don't be scared to update those. This is an example of the actual panel expanded out and what it would look like. We've got Dr. Watson selected. And then you can see over here that I have family practice selected for him. And then I would go ahead and click update. So whenever I launch my home page, my intake, my SOAP, telephone call, provider test action, my default visit type will be there for me. And then I just need to go ahead and select my visit type. Now we're going to go ahead and get into some of that new content that's available with the new intake SOAP and pediatric SOAP template. So we can't customize these templates, but NextGen did think of this, and they have given us nice ways to configure them. So hopefully you guys will take the new template and configure it, so it'll make you guys more upgradable in the future. So over here, just a quick example picture of what it would look like. So I'm on my allergies card, and I've added a custom button to launch a specific template on this card. Okay, so if I go ahead and navigate to my framework content down to my client button configuration panel, I have the intake template selected here. My card name is allergies. So this could be either allergies, reason for visit, orders, and so on. So you guys can see over here, I gave my button caption a name, so my custom button. And then what template do I want to launch? Just picked one in here. So order management is the one that I wanted to launch. And then you'll always have to click uncheck hide. So out of box, all the custom buttons are hidden because they're not in use yet. So you would just go ahead and click hide, uncheck hide, sorry, and then click update. So you can see over here in the allergies panel, I have 3 client button configurations. I can change the order of them if I choose to by selecting the numbers right over here. Okay. Another option that we have is client checkbox configuration. So the previous one gives us the ability to go ahead and add specific buttons to the intake SOAP and pediatric SOAP button to launch templates that my practice might need within my workflow. So, maybe a specific screening tool that I wanted to make sure that my users are doing upon intake. And I want to make sure that they don't forget you've got it customized to launch. We can go ahead and configure that so you guys don't have to customize it anymore. Now, for the client, they've also given you guys an option for client checkbox configuration. So, some of those questions for yes, no options within the templates, you can do that within here. So I have, in here we could say that intake, allergies, we can give our checkbox a caption, and then so on. So that'll be available in there too. So here in the example, we're configuring on our intake template in the general information. I want to go ahead and add a checkbox for my custom checkbox, or patient identity verified. Tons of items that I've seen customized on the intake template, just for a checkbox to verify that staff are doing certain items, or specific questions that you guys want the patient to ask, that could be added in here. In the document too, they've done a really nice job with this. We do not have to customize that document to include that custom checkbox. So in my document, when I generate it, I could say, when this box is checked, I want this phrase to display within my master document when it's generated. Okay. Just like the other one, I would go ahead and uncheck to hide and then click update. And then again, you guys have, in the general box, we have 3 checkboxes we can configure. You can go ahead and change the order of those if you choose to. If you choose not to use a checkbox later, same thing with the button. We can come in here, we can go ahead and check hide and then click update, and that'll no longer be available on those templates for us. So this is an example of what it'll look like. Here's my custom checkbox. And then when I generated my master document, my custom checkbox displays there. So it's whatever verbiage I type in there, when this box is checked, this is what's going to go ahead and display on my document. Okay. In this example, I'm showing you guys how to hide it. So obviously, yep, just click hide and then go ahead and check update, and then it will no longer display on the intake template in my general information. You can always come in here, update, change the names of the captions for the checkbox or the document text if you need to, and then you would just go ahead and click on our update button to update the information within there. Okay. Next one is our assessment and plan configuration. So in spring 2021, NextGen has given us the ability to go ahead and configure what displays on our tabs over here. So I'll show you guys how to do this. For example, if we want to go ahead and remove cosign orders, we can go ahead and remove cosign orders, and then there'll just be a blank spot over here. So we don't have to, customize custom templates to be launched. And then you guys can go ahead and configure this per specialty. So if a specific specialty is interested in cosign orders, we can leave that for that specialty, and then maybe not for others, depending on the workflow. Okay, this is what it looks like on the framework content. We would go ahead and navigate down to the assessment and plan navigation configuration. Over here, you guys could see at the bottom, I kind of removed the cosign orders, so it's not available anymore. But let's say for my office procedures for my family practice specialty, I want to go ahead and launch a different office procedures template than I have for OB. I would come in here, I would select this, and it'll go ahead and give me a pick list. I'll select on my template, I'll click OK, and then I'll go ahead and click Update. One thing to note here, if you guys do have template developers, made some customizations to specific templates, and let's say I have made a copy of my office procedures template, made some modifications to it, and I want all of my specialties to use that one template, you guys don't have to come in here and configure all of that. When that template is copied, you can update template links where it puts logic in the system to say, anytime Office PX is launched, I'm going to go ahead and launch my copy of my Office PX because that's what I told my system to do. So come in here and use this if you guys want specific templates to display for specific specialties within the practice. Okay. All right. So over here, you could see in my couple screenshots behind, you guys saw that cosign orders was removed, and that'll go ahead and reflect on my templates, and it'll show me the changes as I'm making them within this section. So I could see that information update real time. Okay. Another thing we could do is we can go ahead and change the order, just like we've done in other ones. So let's say, my provider often after assessments, they want to go ahead and order their office procedures right away, so the nurse or MA can go ahead and get started on those. So you just work across the top. We'd go ahead and select on our office procedures. I would go ahead and select my number 2 in this case, click update, and over here you'll see that my office procedures now is in the 2nd spot, and my plan is in the 3rd spot. I should have took a update there. So you'll see that it's in the 3rd spot, so it's all been reordered. So when I open up the templates, I'll be able to see that it's now assessments, office procedures, and then my plan. Okay, and here's a screenshot of that updated. So you'll see that we no longer have cosign orders, and then office procedures is in the 2nd spot. You guys also have the ability to go ahead and copy the information from practice to practice from multi-specialty practices. So if you've configured family practice to look a certain way, we can go ahead and copy that information to our other practices if we need to. For those people that are going down to the provider level, again, we recommend against it, but in some cases it is a good feature to use for those subspecialties that might not be available. You can also copy those configurations from one provider to another. Okay, and that concludes the presentation. So I'll go ahead and stop there and open it up for some questions. We've got 5 minutes left.
I don't have any in the box at the moment, but if anybody has anything, feel free to put those in there real quick. Doesn't look like we're getting anything there. So thank you for attending, you guys. You will receive an email with a link to the recording as well as to the slides. You should receive that somewhere in your email box in the next 24 to 48 hours. Feel free to follow up with us on your own if you would like. You can reach out to your particular rep or send an email to info@emedapps.com or give us a call at our main number. We are here to help you with anything discussed today, as well as any other needs that you guys have in the HIT area. Feel free to reach out, and thank you again. Everybody have a nice day.